As one can see from this photo, the patient has fractured her upper left permanent front tooth. Fractures from trauma to the two front teeth in both early and late childhood is extremely common. Some of the more common types of accidents involve bicycle, swimming, trampoline, scooter, and general horseplay. Looking carefully at the tooth that is fractured, notice that there is no bleeding coming from the broken part of the tooth. This is because the fracture did not penetrate the inside nerve and blood supply of the tooth, referred to as the pulp. Although uncomfortable, urgent treatment for this condition is not required to obtain a good outcome. Avoiding very hot or cold foods and taking over-the-counter pain medication can be helpful to reduce discomfort. This tooth needs to be restored with either composite restoration, tooth-colored filling, as is this case, or ceramic crown, tooth-colored cap. Usually in younger patients, a composite restoration is placed. To start the procedure of repairing the fracture, the tooth's rough edges are smoothed down and the tooth is prepared to attach the filling to the tooth. Notice again, there is no bleeding coming from inside the tooth. The tooth is then additionally prepared with a solution of weak acid called etch, and this creates a microscopic lattice of hard material, like a steel frame, that allows the filling material to bond or attach to the tooth. A clear plastic strip is then used to form a frame around the tooth and prevents the filling material from oozing out around the tooth. This photo shows the filling material firmly formed around the existing fractured natural tooth. The tooth to the left has a faint white line. This is called an infraction, which is a fracture that is confined to the first layer of tooth, called enamel. With the clear plastic strip still secured to the tooth, a special curing light, somewhat like a laser, is used to cure or make the filling material hard. The composite filling material is now hard and attached to the tooth, but still needs to be finished and polished. The composite filling material is shaped and polished with a disc and other polishing instruments. Which of the front teeth was fractured? It's the one on the patient's left side. The color, texture, and shape of the natural tooth should be copied as closely as possible. Composite restorations do not transmit light as well as the natural tooth, and this means that in some light conditions, it will not look completely the same, but most of the time, they look very good. The front tooth was restored shortly after it was fractured and took about an hour. The patient can then go back to school or work with a fully restored front tooth and a confident smile.